Welcome back to the Special Good Day PA. In our last segment, one of the procedures Dr. Kozak talked about was the TAVR procedure. Correspondent Carrie Perry is here to share with us how this procedure helped one patient. Carrie.
Yeah, thanks, Amy. For Stu Levin, getting through normal everyday activities became difficult. His heart was to blame. Here's Stu's story. Stu Levin of Hanover had been suffering with heart disease for years.
I couldn't walk more than 5 or 10 steps without gasping for air, without being totally out of breath.
An echocardiogram revealed that Stu had a bad aortic valve.
I knew that my wife was concerned, but I was very hopeful.
To correct the problem, Chief Cardiac Surgeon Dr. Walter Pay performed the TAVR procedure, a minimally invasive heart valve replacement.
Under local anesthesia, we pass these up through the big blood vessels in the legs, much like a heart catheterization. The catheter itself is about 5 or 6 millimeters in size, and it goes through a sheath. And as it goes through the sheath, the technology allows the sheaths actually to expand. We have roadmaps that we do with angiography on a CAT scanner that allow us to pick the right vessels and the right sizes and the right locations, because there's many alternative approaches to get to the heart. Once we're in that big blood vessel and we get across the valve, then either the valve is released and itself expands, or it's placed on the catheter on a balloon and the balloon's blown up and the valve expands, and then it's held in place.
Dr. Pay notes that most patients can expect to do well post-procedure.
In fact, their symptomatology is almost instantaneous. Now, sometimes the patients that are way over the edge in heart failure will require some adjustment in drugs and things, but the individuals that are pretty well tuned up before they have this procedure, they're really much better right away.
The following morning, I got up to walk. And it was great. I could actually walk, and not have to stop every 2 steps.
When they're done awake with local anesthesia and some supplemental, what we call conscious anesthesia, they go home the next day.
Through Dr. Pay, and his associates, they put in a new aortic valve, and I feel great now.
As Stu said, walking is no longer a problem. He'll continue to follow up with his doctors to make sure his new aortic valve is working correctly. And we'll be right back.